Hello friends, welcome back to my YouTube channel. I am Dr. Vijayant Govinda Gupta, the highest volume varicocele microsurgeon in the New Delhi, India. Today we are going to talk about 10 steps to a good, successful varicocele repair. If you're a man with a varicocele and the varicocele has caused problems like infertility or pain and looking for to get a good varicocele repair which the lowest recurrence rates and the highest success rates, then the varicocele microsurgical repair is the repair of choice. I have many videos on why the microsurgical repair trounces laparoscopic and embolization. That's a different topic. What we're going to talk about today is that what are the 10 steps that a good surgeon would take to give you an excellent microsurgical repair. So the first step starts as soon as the diagnosis is made. A good surgeon will identify the varicocele when it's early. Usually finding a varicocele on the ultrasound or on clinical examination is very important. Doing an examination when the patient is anxious or in the cold room or in the lying down position will usually miss mild varicoceles. So finding a good quality Doppler, doing it in the standing position, using a warm room, and also looking for testicular size and minor impairments in your seminal emissions will identify mild or smaller varicoceles that may require treatment. So making a good diagnosis is the first step to do a good repair. Second would be optimization. Sometimes we hurry into a varicocele surgery, but first need to identify is that whether the patient is optimized. So normally before surgery, a well optimized patient, a patient who understands what surgery is undergoing, a patient whose sperm counts and his hormonal levels have been adequately tested, storing the semen before operating on a varicocele patient is of utmost importance, because this semen with severe oligospermia may be the only source of sperms. Sometimes the varicocele microsurgery may not work. So understanding the diagnosis and optimizing the patient is the second step for a successful varicocele surgery. The third step would be the incision. As of now, the subinguinal approach, the Goldstein Subinguinal approach, which is basically making the incision just when the superficial inguinal ring ends at the root of the scrotum, is considered to be the most cosmetically appealing incision, as well as a very small incision, the entire spermatic cord along with the contents can be accessed. The incision is small, quick to recover, quick to heal, and at this level we are able to find 3 to 4 dilated veins, and almost all the tributaries have already entered before, so we are able to give a good result to the patient. Now the most important step in a varicocele microsurgical ligation is to get all the veins. All the veins is important, because if you're going to leave back veins, then it's going to lead to recurrence and it's going to lead to failure of our microsurgery. So a good surgeon or a good varicocele microsurgery means that all the veins that are dilated have to be ligated. So you have to look for the perivasal veins, you have to look for the difficult veins in the cremastric, you have to look for all the veins in the pampiniform plexus, and the dissection has to be extremely carefully done so as to not to damage the arteries. So get all the veins but leave all the arteries. So it is also of utmost importance that the testicular artery, the vasal artery or the artery to the vas, as well as any accessory cremastric arteries that may be present are preserved. Usually to identify arteries and to be extremely sure that it is not damaged, in my practice we use a handheld Doppler along with papaverine injections to allow us to identify every artery and to preserve. So if we preserve the arteries and get the veins, the results are going to be tremendous for sure. At the same time, it's also important that nerves and lymphatics are also identified and left alone. This prevents post-operative pain and prevents post-operative formation of hydroceles. So a well done surgery will just get the veins and leave everything else intact and good for the patient. Apart from these facts, there's a new concept which is coming in, which is called as the release of the fascia. So if the vasal packet or the spermatic cord packet, the entire fascia is released, it helps in elongating the veins, prevents kinks in the venous blood supply, and it also prevents recurrence and allows us to have a better result from the varicocele repair. Excuse me. So when we do the surgery, we make sure that the entire fascial attachments along with any hindrances in the blood flow are usually removed, and after that, under the microscope, the veins are ligated. This gives me a better success rate as compared to my peers. Then one more small modification that we do in our surgery is that we fix the testes and the cord to the incision site. We do this with the help of a small non-resorbable suture. This allows us to take the pressure off the testis, allowing better recovery and better results in terms of pain relief. Apart from that, the post-operative recovery instructions are very important. Wearing a scrotal support, avoiding sexual intercourse, avoiding use or extreme exercises or extreme heavy activities, avoiding high temperatures, avoiding constipation. There's a long video on post-operative instructions, but taking good post-operative care of your testes after the varicocele repair is also going to go a long way in healing your varicocele, in getting good success rates and preventing recurrence. So if you want a good varicocele repair, the first choice is to identify your varicocele correctly. Second is to choose a good surgeon who knows what he is doing. And third is taking good care of your repair once it is done. If all these three factors meet, then usually the patients are rewarded with long-term pain relief as well as a rapid and an amazing increase in their sperm parameters. If you're looking for a good quality varicocele repair in India, at my practice we perform almost 100 varicocele repairs every quarter. We have the latest German instruments along with all the peripheralias required to do a good job. Apart from this, the surgeries are performed by myself, and I have experience of more than 10 years in doing a good quality varicocele repair. You can connect with me on Facebook or on email or on my website, or you can also write to me on WhatsApp. Thank you for listening in. Like my video, subscribe to my channel, and take care.